Do you suffer from clogged ears, ringing in the ears, or strange pressure deep inside your ear canal? Do you suffer from ear pain that no one can really explain? Do you have these symptoms and no one really seems to know why? Maybe you've seen your general practitioner or your ENT, ear, nose, and throat doctor, and they have examined your ears and told you that your ears look fine and there are no abnormal signs in your ears. But what if the root cause of your ear symptoms is not your ears at all? Hi, I'm Dr. Priya Mistry, a general dentist located in Vancouver, Washington, where we are dedicated to taking care of those with TMJ disorder. Over the years, I have helped thousands of patients find relief from chronic jaw pain, and a surprising number of them came to me initially because of unexplained chronic ear symptoms. In today's video, we're going to explore the powerful and often overlooked connection between chronic ear problems, ear pain, tinnitus, and temporomandibular joint disorders, or TMJ, TMD. Let's dive into the latest research and proven treatments to help you understand this connection, and most importantly, what you can do about it. Section 1, how TMJD affects the ears. Let's start with the anatomy. The temporomandibular joint, or TMJ, is located just mere millimeters, in front of your ear canal. It's one of the most complex joints in the body, allowing your jaw to move up and down, and side to side, and forward and backward. But when this joint becomes inflamed, misaligned, or overworked, strange things can start to happen. Because of how close the joint is to the ear, TMJ dysfunction can create pressure, pain, or unusual sensations that feel like they're coming from inside your ears, even when your ears themselves are perfectly healthy. According to a study published in the International Tinnitus Journal, 87% of patients with TMJ-TMD reported ear-related symptoms, and 42% experienced tinnitus, which is ringing or buzzing in the ears. So why does this happen? One key reason is shared nerve pathways. The trigeminal nerve, which plays a huge role in jaw movement and sensation, also connects to muscles in the middle ear. When there's dysfunction in the temporomandibular joint, the jaw joint, it can send altered signals to the dorsal cochlear nucleus, a major processing center for sound in the brain. This means that your brain may interpret a jaw problem as an ear problem. I've had patients that describe pressure, congestion, fullness, popping, aching, or even stabbing ice pick-like pain in their ears. Many patients also complain of vertigo or dizziness or feeling off balance or just like a general sense of unease. After seeing multiple ENT doctors and audiologists, they were told, "Your ears look fine." It wasn't until we addressed their jaw problems that their symptoms started to resolve. Section 2, how ear pain and ear problems are connected to TMJ disorder. Now I will explain some of the most common ear symptoms that TMJ, TMD patients complain about and what causes them. Let's start with stuffy ears, ear congestion, and ear fullness. Different ways to describe similar sensation. So this sensation of stuffy ears is typically caused by muscular dysfunction in the muscles that surround and support the eustachian tube. These muscles are called the tensor tympani and the levator villi palatini muscles. One of the functions of the eustachian tube is to equalize the air pressure between the middle ear and the outer ear by opening intermittently. But if the muscles that surround and support the eustachian tube become dysfunctional, then it can put undue pressure on the eustachian tube, and that can result in dysfunction. When this happens, you can experience ear congestion, fullness, or a feeling like your ears are popping or need to be popped, like all the time. Not fun. If we can find a way to relax those muscles that surround and support the eustachian tube and restore normal muscular function, then these uncomfortable ear symptoms can be significantly reduced or eliminated. Now let's discuss vertigo, dizziness, or feeling off balance. The temporomandibular joints, the jaw joints, are located very close to the semicircular canals, which are 3 fluid-filled tubes in the inner ear that help with balance by detecting head movements. The temporal bones, these big skull bones here, contain the semicircular canals. So if there's dysfunction in the muscles connected to and surrounding the temporal bone, it can lead to vertigo and dizziness because of the close proximity of the body's balance control mechanism and the jaw joints. Finally, I would like to explain some of the causes of ear pain. Many patients come in here complaining about a sharp stabbing pain in the ears or a dull aching pain in the ears. Many people will say this all started because I thought I had an ear infection. My ears started hurting out of nowhere, but the ear doctor said that I didn't have an infection. So the ear pain in those that have TMJ, TMD can be explained by two primary structures. The first is the discomalleolar ligament, which directly connects the jaw joint to the middle ear. Interesting, right? This ligament attaches to the articular disc inside the jaw joint, and it goes from there all the way to the middle ear. So if this ligament gets overstretched or strained, or if the articular disc becomes dislocated, or if there's muscle dysfunction in the muscles connected to the jaw joint, it can result in various types of pain in the ear. The second biggest cause is the lateral pterygoid muscle. This muscle, I call it the troublemaker. The lateral pterygoid directly attaches to the articular disc, and it has muscle fibers that run behind the eye and the area surrounding the ears. Therefore, pain and dysfunction in the lateral pterygoid muscle can cause referred pain in the ear and many other ear-related symptoms. Section 3. So who is most at risk for TMJ, TMD related ear symptoms? Certain groups are especially susceptible, and knowing the risk factors can be life-changing. People who grind or clench their teeth, a condition known as bruxism, often linked to stress or sleep disturbances, those people are definitely more prone to these ear-related symptoms. Those under chronic stress, which causes jaw tension, neck stiffness, and shallow breathing, all of which strain the jaw joints. These people are also more prone to these ear-related problems. People with poor posture, especially during long hours of computer use or smartphone scrolling, sound familiar? Which can create forward head posture and therefore muscle imbalances. Women under 40, studies show that this group is particularly vulnerable to both TMJ, TMD, and related ear symptoms. In my own practice, I've seen this pattern again and again and again. A patient will come in with ear pressure, sensitivity to sound, or unexplained ear ringing, and it turns out they've been clenching their jaw for years without realizing it, or grinding their teeth. Often, the ears are simply the body's early warning signal that something deeper, something else is going on. Section 4, treatment options that actually work. So here's the good news. TMJ, TMD ear-related symptoms are typically treatable. In my practice, I use a combination of custom-made orthotics, myofascial release, and osteopathic manual jaw manipulation. The custom-made orthotics, also known as oral appliances, are uniquely measured and designed for each individual patient. They reposition the mandible, the jawbone here, into a position where the joints are decompressed and the orofacial muscles are in their most relaxed neutral state. This is known as their correct resting length. Over time, this gives the articular disc the opportunity to be recaptured if it is dislocated or displaced. Myofascial release, or MFR, is a manual therapy technique used to release tension and restrictions in the fascia, the connective tissue that surrounds the muscles of the head, face, jaw, and neck. Myofascial release involves applying gentle, sustained pressure to find and release restrictions, aiming to improve pain, jaw range of motion, and overall function in the craniofacial system. Osteopathic manual jaw manipulation is a hands-on technique which is used to treat jaw pain and TMJ disorders. It focuses on restoring proper alignment, function, and mobility of the TMJ and surrounding structures. Osteopathic manipulation can involve techniques like soft tissue manipulation, joint mobilization, and intraoral work to relieve muscle tension, improve joint function, and alleviate pain. More recently at my practice, I've started using a method called disclusion time reduction therapy, DTR therapy. If you want more information on what this is, I've linked it above and below. But basically, it's measuring relative bite force and muscle activity and jaw movement in real time and making minor micro adjustments on the teeth to calm the muscles down and build a balanced bite. So for more information on that, again, I've linked it. And ultimately, I think it is just important to use a multidisciplinary approach to treat TMJ disorders and ear-related symptoms. This means working with a team that understands both dental anatomy and how it affects the ears and the nervous system. Many of my own patients report significant improvements in their ear symptoms, and some even experience complete resolution once we address the underlying jaw dysfunction. For most patients, it usually takes 1 month of treatment for these improvements to occur. But for some patients, it can take 3 to 6 months or longer. Also note that tinnitus, ear ringing, ear buzzing, does not respond as predictably as ear fullness and ear pain and even hyperacusis to my treatment. And remember, every single case is unique. What works for one person might not be enough for another. That's why getting a full evaluation from a dentist or doctor trained in treating TMJ, TMD is so important. Not only trained, but experienced. Section 5, when to see a TMJ dentist. Now, you might be wondering, how do I know if I should see a TMJ dentist? Here are a few red flags to look for if you have chronic ear pain or fullness, or if you have unexplained ringing or tinnitus in your ears. You feel like your ears are clogged, but nothing shows up in medical or ear exams. These are all good reasons to seek out a TMJ dentist. In addition to everything I just listed off, if you also have jaw pain, clicking, facial tension, or neck tightness, those are signs that this could actually be a TMJ problem. These symptoms may all be connected, and they are often caused by dysfunction in the jaw joints and the muscles that surround and support the jaw. If this sounds like you, don't wait. Early intervention is key. TMJ symptoms can definitely worsen over time and lead to more chronic pain, fatigue, and nervous system issues if left untreated. Keep in mind that TMJ, TMD is a chronic progressive disease. Once it starts, it typically does not get better on its own. By seeing a TMJ dentist or TMJ physical therapist who understands both dental and ear anatomy, you'll be taking the first step toward long-term relief. Understanding the link between TMJ disorder and ear problems can be life-changing for many people. So many people go from doctor to doctor to doctor to doctor without answers, but the answers might be closer than you think. If this video helped you to better understand the connection between your ear symptoms and your jaw, please give it a like, leave a comment sharing your experience, and subscribe to my channel for more educational videos like this. And if you have a specific question about TMJ, TMD, ear pain, or other ear problems, please leave a comment and I will do my best to reply to as many as I can. If you want to learn more about how I treat TMJ, TMD with a 90% success rate, watch this next video right here. I'll walk you through my exact approach step by step. I call it the Priya method. And remember, you are not alone and you don't have to live in pain. Thank you so much for watching. I'm Dr. Priya Mistry and I'll see you in the next video. And remember, my friends, you can never have TMI about TMJ. Thank you.